Alright, this is my med administration checkoff video. Probably not going to be able to hear me very well because I have a mask and there's a bunch of people. So I would verify my order, check the patient's chart for any allergies, gather my equipment, med cup, my syringes, alcohol wipes, wash my hands. I would prepare the meds one patient at a time and check the 7 rights of administration. Drug dose time, route, patient, indication, and documentation. I would select the correct drug for the patient and compare it to the MAR. That was my first check. Then I would check the expiration date of all medications and vials, which I will get now. This is the Colace, 100 milligrams from the MAR. This is the Toradol, which is 60 milligrams. And then the NPH insulin, which is 5 units. Before they're going in the patient's room, I'm going to verify the patient's name on the MAR with the labels on the drugs. That's my second check. For the oral meds, I'm just going to take the tablet, compare it to the MAR, double check that it's for the correct patient, it's the correct dose, put it in a medication cup, leave it in the wrapper, set it to the side. For injections, I'm going to review the MAR to determine where the last injection was given because it doesn't want to be done twice in the same place, so we would rotate locations. I would determine the appropriate size needle and the syringe based on the med and the patient. If it's required, I would get the med from an ampule or a vial. So using sterile technique, I'm going to put on my gloves. And I'm going to wash or clean with alcohol the tops of both my vials of my Toradol and my insulin. So then I get my syringe for my Toradol, push the plunger all the way up, make sure there's no air. Attach my needle for drawing. It's 60 milligram ordered. There's 30 in the vial, so it's going to be 1 mil. Pull it to 1 mil. Inject it in the vial. Push the air in. Turn it over and draw up my medicine. Make sure there's no bubbles. Set this off to the side. I would label it for the patient and the medication. Change my needle at this time while I'm thinking about it. Now set it off to the side. I couldn't find a smaller insulin syringe, so I'm just going to pretend this is the small one and that it's 5 units. So I've already cleaned the top of my insulin bottle. I'm going to draw to 5 units. Put it in the bottle. Push the air in. Turn it upside down. Draw to 5. Make sure there's no air. Label it with the medicine and the patient's name. Set these off to the side. Put my medicine vials up. You can walk behind me, it's fine. I was in your whole video. Then to administer, I would take these off, wash my hands, go to the patient's room, close the door behind me, introduce myself, identify the patient with 2 identifiers, perform necessary pre-administration assessment for specific meds, and then at the bedside again, I would compare the medicine to the patient's MAR, and the names and labels. Tell them a little bit about the medicine, why they're taking it, side effects, ask them if they have any questions. Then for the oral, I would just have them sit up, give them 1 pill at a time in the medicine cup, and offer them something to drink to swallow it, water, whatever they have at the bedside. For the injected medicines, I'm going to tell them that it might burn or sting a little. which is kind of expected. Then I would select the appropriate injection site. So make sure there's no bruises, inflammation, lesions, rashes, anything like that. For the insulin, I'm going to pick the stomach. So I'm going to put on clean gloves, clean their stomach with an alcohol swab in a circular motion. Hold the syringe between these fingers. I'm going to put my hand on their stomach, pinch a little bit, take the cap off, put it in the skin at a 90-degree angle, slowly inject, rest my hand, pull the needle out, put it in my sharps container. I'm not going to recap my needle. I'm just going to put it straight in the container. Not worry about the gauze pad, like Ms. V said. For the IM, I'm going to do the ventrogluteal. So I have my Toradol. I'm going to put my hand. It's their right hips. I'm going to put my hand this way. Spread my fingers. Make sure I find the right spot. Clean it with an alcohol swab. Oh, excuse me. I'm gonna go in quickly at a 90-degree angle, aspirate, make sure I don't have any blood, then inject the medication no faster than 1 ml every 10 seconds. I'm gonna wait 10 seconds. After I inject, then slowly withdraw the needle. Put it in the sharps container. Do not recap. If the patient needs a gauze pad, I would put it on, apply gentle pressure, but not massage. Maybe get them a Band-Aid if they need it. I'm gonna pick up all of my trash, my alcohol pads, throw them away, take off my gloves, wash my hands. At the end, I'm gonna make sure the patient has swallowed all oral medications before I leave. I'm gonna help them to a comfortable position. I've already thrown everything away. I've already washed my hands. Make sure they have the call light within reach, the bed is lowered, the rails are up. Ask them if they need anything and tell them thank you for letting me take care of them. Then I'm gonna go and document everything I gave, how the patient tolerated it, and where I gave the medication.